Let's talk inflammation. Many people come to me asking about their pain or their symptoms they're having, and they have the impression that symptoms must be coming from inflammation, or that because they hurt, their body part therefore is inflamed. And while they're just trying to convey the idea that they're having a flare-up or their symptoms are aggravated, I often feel compelled to make a bit of a clarification. There are some distinct characteristics of inflammation, including redness. The joint or the body part is flush or discolored. Swelling. It shows a visible increase in size. Pain both with activity and at rest. And fever, it's warm to the touch. So pain is one of the characteristics of inflammation, but not all situations where there's pain are because of inflammation. Inflammation has some common characteristics in the patient's history or story that's consistent. It's of recent onset. It hasn't been there for weeks or months. It's a constant symptom, meaning it's there when you're sitting or standing, lying, when you're still and when you're moving. It's there all day, all the time, every day. Maybe with different intensities, but it's there, not a come and go type of pain. It gets worse with continued use. Oftentimes people describe symptoms that are inflammatory, that when they start an activity, they may feel it to some degree, but as they continue, it observably gets worse. It's not the opposite where it starts out painful and the more they get warmed up, the better they feel. And finally, there's a lingering pain. There's an ache or a throb which persists at rest, even when they're active. So remember, pain does not equal inflammation. But why is this important? Well, it's important because if you give an anti-inflammatory treatment to a condition which is not inflammation, thinking it is inflammation, you're typically not going to get the results you're looking for. And besides that, anti-inflammatory medications, those medications that are commonly prescribed or marketed as solutions for pain, used chronically can sometimes lead to gastrointestinal problems, including ulcers, and that's never a good thing. So if you're having pain and you assumed it was inflammation, but now that we've talked, you understand it may not be, and if you have questions and an interest in a 20-minute free screening to see if I'm a good fit for you, reach out to me at jasonwardpt.com.